Hi, everybody. It is a pleasure to welcome you to our Grand Rounds lecture, and I am so pleased to introduce Dr. Susan Anenberg, who is Professor and Chair of Environmental and Occupational Health at George Washington University Milken Institute School of Public Health. She also directs the GW Climate and Health Institute and the NIH-supported Reach Center, Dr. Anenberg's work focuses on understanding how air pollution and climate change affect human health from local communities to the global scale, and on translating that science into action to protect public health. So thank you so much for being with us today, and the floor is yours. Oh, I haven't done anything yet. Hopefully you'll clap at the end. Do I need to speak into this for people online to hear? Okay. Well, thank you so much for being here. I really appreciate it. I know how valuable all your time is, and I have the pleasure of being back. I was here a few years ago, so hopefully I have some new things to show. But the work has developed over a long term that I'll be sharing with you today. So I hope it's not too much repetition from a few years ago, but I really do appreciate you being here. So what I'm going to talk about today is what we can tell from satellites in terms of tracking cleaner, healthier cities in a changing world. So maybe I need to click on this again. Let's try that. Yeah. Okay. So I just want to quickly introduce myself and how I came to this, because I find myself shocked on an almost daily basis that I have a career in academia. I never really thought that I would. I thought I was on a medical track, frankly, in undergrad. I was a student at Northwestern University and got a job as an emergency room technician at Evanston Hospital, right near Northwestern. And so I was working overnights in the emergency room. I was also a double major in environmental science and biology. And that was a very formative experience for me because I started to realize that we would see people in the emergency room over and over again, and many times for the same symptoms of shortness of breath and heart issues. And my education and my coursework just kind of clicked that there might be some ways to address health on a larger scale, on a population scale, before people landed themselves in the dire straits that they were in when they visited the emergency room. And I couldn't think of a better way to address this beyond the environment that we are exposed to. The air we breathe, the water we drink, the weather we're in. These are all factors that really affect our health, and can manifest in people experiencing these symptoms that land them in the emergency room. So I actually took a class at George Washington University after undergrad, and I'm delighted now to be the chair of the department that I took the class in. But I decided to do a PhD in atmospheric science, environmental science and engineering at UNC. And actually my first job as a grad student was a lab-based position where we were exposing human lung cells to vehicle exhaust, and trying to figure out the inflammatory markers that indicated how problematic diesel exhaust was compared with biodiesel exhaust compared with gasoline. That year, everything broke in the lab, and I decided to be in charge of my own destiny and work with computers instead. And so that is how I got to atmospheric modeling, actually. And so I started to figure out how to use computers and computer coding and modeling to estimate air pollution impacts of emissions and emission changes. But I was always very interested in policy and how environmental policy could impact the environmental conditions and health as a result. And so about halfway through my PhD, I got a job at the EPA in a group that no longer exists called the Office of Air Quality Planning and Standards. And my job was to estimate the health benefits of air quality regulations. I was there at the time of the Obama administration when we were implementing reviews of the National Ambient Air Quality Standards. We put in place the mercury and air toxic standards and the first greenhouse gas regulations. So it was really, my PhD was very educational. My real education, I like to say, was that work within the federal government, because we would go to these public meetings, we would hear from everybody in all walks of life, and really learned a lot from that time there. I spent a year working at the Department of State, helping to set up the Climate and Clean Air Coalition and working on clean cook stoves. And then the U.S. Chemical Safety Board, which investigates chemical explosions and releases. Like I said, I never thought that I would find academia to be the right pathway for me. But I found GW, which at the time, it still is very welcoming of research translation into policy. That's what really drives me. I really enjoy thinking about how we can improve policy to improve health for people. And what research do we need to fill the knowledge gaps to be able to advance that policy? So that's what I love to do. You'll see that what I'll talk about today is all within that vein, thinking about how climate change and air pollution are interlinked and how we can address both of them together. So this is a little schematic just to show that anytime we burn anything, fossil fuels especially, but biofuels too, we are releasing a mixture of pollutants, including greenhouse gases and air pollutants. And both of those affect human health in a variety of ways. They also interact, so air pollution can impact climate change. We have short-lived climate pollutants like methane and black carbon, for example, which warm the climate. And climate change can also affect air quality. Consider things like wildfires and ozone formation and dust. And so these are interlinked problems. What we've done in the United States is we've tried to break that arrow there from emission sources to air pollution. And we've done that very effectively through the 1970 Clean Air Act and the 1990 Clean Air Act amendments. We've put on place scrubbers on our power plants, catalytic converters on our gasoline vehicles, diesel particulate filters on our trucks and buses. And those have been very effective at bringing down air pollution levels coming from those exhaust streams. But we have done nothing to affect that arrow on the right-hand side from emission sources to climate change. So greenhouse gases are being emitted, pretty much in an unabated fashion. And that is now causing impacts on air pollution through that rightmost arrow, because even though, say, fine particulate matter, those really tiny solid and liquid particles that can lodge really deeply into our lungs and affect every organ of our bodies, even though those levels of fine particulate matter have been coming down over the past decades throughout the United States, we're starting to see that plateau on a national basis, and especially in the Western US, which is affected more so by wildfires. So we won't be able to solve our air quality problems in the United States just by breaking that arrow between emission sources and air pollution. We also need to be addressing the arrow that goes from emission sources to climate change. My work focuses a lot on urban health because there's a lot of urban health challenges. So one challenge is health inequality. This is the diamond here is Washington, D.C. The green color shows pediatric asthma emergency department visits per 100,000, and the red dots show life expectancy. So let's just take a look at the red dots first. There's about a 20-year life expectancy differential between some neighborhoods in the Northwest quadrant versus some neighborhoods in the Southeast quadrant. These are people who live just a few miles away from each other. So 20-year life expectancy differential. The green color shows something similar for pediatric asthma ED visits, much higher rates for people living in the Southeast quadrant versus the Northwest quadrant. And that is, by the way, not unique. This is Washington, D.C., but if you looked at health inequality for pretty much any major city across the United States, you'd see a similar picture. We also expect a lot of population growth in urban areas globally in the next couple decades. So about half the world's population lives in urban areas today, and that's expected to grow to about 2/3 by 2050. And almost all of that growth in urban areas is expected to happen in Africa and in Asia, places where environmental quality is continuing to worsen as well. And so let's talk about those urban environmental challenges. Right now, about 75% of global CO2 emissions come from urban areas. And that is growing in Asia and Africa as those populations expand, as that urbanization continues, and where they have, particularly where they don't have stringent emission control policies. We also experience poor air quality. That's certainly globally in urban areas, but even in the United States, this is nitrogen dioxide pollution, which I'm going to go into more detail about. But we still see a lot of urban air quality challenges in urban areas. And then we also have a lack of natural space in our built environment in urban areas. A lot of heat challenges as a result of that urban heat island effect. So there's a lot of compounding urban environmental challenges. And that's one reason that I focus on, that I'm going to focus this talk on cities. So what we'll talk about today is two parts. The first part is how we have developed methods to track urban pollution, carbon dioxide, and green space globally, because we can't fix what we can't measure. And then part two, we're going to talk about the translational aspect. So employing the new data to make progress towards cleaner, healthier cities. So one challenge with the with the urban landscape is that we don't have a whole lot of urban targets when it comes to environmental quality. What are cities around the world trying to achieve? So for greenhouse gases, we're starting now to see cities develop targets for greenhouse gases through their climate action plans. C40 Cities is a network of nearly 100 mayors of major cities around the world that they have led the largest climate action planning process for cities worldwide over the past decades. But it's not just those cities that have climate action plans. Many cities around the world now do have climate action plans. And many of those do have percentage targets that they're trying to achieve for reductions in CO2 emissions. We don't really have targets at the urban scale for air pollution. Most of the goals that that governments around the world are trying to achieve when it comes to air quality are at the national scale. And that's because either nations have national ambient air quality standards like we do in the United States, or they try to follow the World Health Organization's air quality guidelines, which are just guidelines, they're not regulations. But at least they're a target. The urban climate action plans are also typically not regulations. Those are just stated targets that the cities have. So what you see here in the middle is a map of the places around the world that do have ambient air quality standards and the stringency of those. But even the most stringent air quality standards, ambient air quality standards, like here in the United States, are not clean enough to actually be protective of public health. And they're not as stringent as the World Health Organization guidelines, if those guidelines were required. So typically our urban areas try to follow the national scale targets for air quality, and there's not really separate targets at the urban scale for air quality. For natural spaces, there has never really been clear targets for urban areas, but there is now a new initiative that C40 is leading called the Urban Nature Accelerator. Used to be the Urban Nature Declaration, now they call it the Urban Nature Accelerator. And I'm going to go into some detail about this. I won't talk too much about it now, but just suffice to say that cities have now committed to achieving one of two green space targets. But it's pretty much limited to just these cities that are in the C40 network. Now, what if you want to measure how cities are performing against these targets? One way you would do that is through ground level monitoring. So here is a map of air quality monitors that exist around the world. And you see that they are much more densely located in the United States, in Europe, and now India and China, but that's a little bit newer. And you see that much of the world is still left pretty much unmonitored. And even if you were to zoom in on one particular city, like the Washington, D.C. on the right-hand side here, you would see that there's really only 5 monitors on the ground in Washington, D.C. for PM 2.5, those fine particles. It looks like 4, but 2 are co-located. So if somebody wanted to ask you the question, which somebody did come to us at GW, the District Department of Energy and Environment, and say, how much is air pollution contributing to that 20-year life expectancy differential that we see between neighborhoods in DC? You can't use these ground level monitors for that because there's not separate monitors for those neighborhoods. We don't have a great sense of granularity in terms of who's exposed to what within cities. What we do have now that we can leverage is a very healthy fleet of space-based observational instruments that are taking measurements of environmental quality here on Earth. And a lot of these are measuring temperature or green space or air quality. And we can use these to try to track conditions in urban areas worldwide. So that's what we've been trying to do over a period of about a decade. And we're very grateful to NASA for continually supporting our work on this. I will say this fleet is in danger with the current administration and the current lack of a federal budget. But at least for now, we have these assets flying, and we can also take advantage of assets from the European Space Agency and space agencies around the world as well, which can be helpful. So one of those assets is the TROPOME sensor, which is on the Sentinel-5P satellite that was launched by the European Space Agency. And with this TROPOME satellite, this is a polar orbiting satellite, so it flies around the planet, and it takes a snapshot of air quality on every location of the planet at about 1:30 p.m. local time. So at about 1:30, we can get a sense for what the pollution levels are in every location on the planet. And that's what you're seeing here on the right. So this is nitrogen dioxide in 2019 as observed from this TROPOME satellite. And what we can do with the satellite observations, it's so valuable to have these because they're really filling in the gaps between the ground level monitors that we have. So we can, it doesn't matter whether there is a ground level monitor, in a location of interest, we have a satellite reading, and we can use information from that satellite reading to estimate the pollution levels on the ground there. What the satellite sees, though, there are limitations to satellite data, and one of them is that what the satellite sees is the amount of molecules between the Earth's surface and the satellite. So you're seeing like a column, a number of molecules in a column, essentially. And what we care about is the amount of pollution at the nose level where people are breathing. So we can use some scientific approaches to try to convert the satellite NO2 columns, nitrogen dioxide columns, into ground level estimates of nitrogen dioxide. And this is an example of how we've done that. This is led by Andy Larkin from Oregon State University, where we developed a land use regression model that reads in the TROPOME NO2 data. And it also reads in data from variables on how the land is used, how much built up area there is, where the highways are. And we can generate very high resolution, spatially granular and temporally granular estimates of nose level NO2 pollution that we can use in global scale studies. So just zeroing in on some of these cities, you can see the level of detail that we can estimate. Now, we don't know whether these are 100% accurate. Well, we know they're not 100% accurate, but how accurate are they? It's very difficult to tell this because we don't have enough monitors to check. We can check it against the monitors that we have, and we do pretty well in those monitor locations, but we don't know how well we're doing in the areas that we don't have the monitors. So that's still an open question that, of course, we're trying to improve upon. But it's not just nitrogen dioxide. And by the way, nitrogen dioxide is an important pollutant to look at. I know a lot of people in the air quality space are focused on fine particulate matter and ozone. Those are from the information that we currently have, those are the main contributors to the burden of disease from air pollution. So those are the key pollutants to be looking at. But nitrogen dioxide is a precursor to those two pollutants. So if you want to address PM2.5 and ozone, we need to be cutting down on NOx emissions. And the newest epidemiology shows that there are also connections between NO2 pollution and pediatric asthma development, as well as other health outcomes. We don't know whether it's NO2 itself as the putative agent, or is it a marker for the traffic-related air pollution mixture or the combustion-related air pollution mixture, remains to be seen. But NO2 is a tracker of that combustion-related pollution mixture in a way that we can't really use PM2.5 and ozone for. So it's a very complementary pollutant to be looking at compared to PM2.5 and ozone. We can also use satellite data to inform us about where CO2 emissions are coming from. So this is led by Do-Yeon Ahn and Dan Goldberg. Do-Yeon now works at NASA. and Dan with me at GW. And we didn't create a CO2 emission data set here, but we're just using the gridded global scale CO2 emission data sets that other people have created in the community, and just trying to pull out the urban areas from those. And we can see that the data sets have gotten spatially granular enough to do that. And so here's what we learned from those global scale data sets. We have done a lot of checking of these data against bottom up estimates of CO2 emissions that cities have generated, say, by working through C40 and the technical assistance that the C40 network gives them. We do a lot better. The gridded estimates do a lot better compared with the bottom up estimates from the cities in the regions of the world that you would expect. So like in North America and in Europe, they do pretty well. In the rest of the world, there's quite a lot of mismatch. But it's those comparisons and the mismatches that are actually really informative to us. I don't love seeing those mismatches, but I find them very informative because those are where we can make progress on our estimation approaches, both in the bottom-up approach and in this top-down approach, to try to get a better sense of where the CO2 emissions are coming from. We can do this also for PM 2.5 and for ozone. And so Suyan Kim, who's a PhD candidate working with me at GW and co-mentored by Gage Kerr, has looked at PM 2.5, ozone, nitrogen dioxide, and fossil fuel CO2 emissions per capita in all cities around the world, and there's about 13,000 of them. And you look at them at the same time. Normally people are going pollutant by pollutant here. So here we're looking at all 4 of these pollutants at the same time. And this is informative because they have different patterns, different spatial patterns, different temporal patterns. So just look at PM 2.5 in the top left. We see that the highest levels are in northern India and in Africa, with lower levels in the United States and Europe and parts of Latin America. Ozone, we see pretty high, pretty elevated levels everywhere, with the worst in the Middle East and India. Nitrogen dioxide, mostly high in high-income areas. So you see more red dots in the United States and in Europe and parts of China as well. And then fossil fuel CO2 per capita, more speckled there, isolated major cities with larger CO2 emissions per capita. So what can we learn by looking at all 4 of these pollutants at the same time? Suyan spent a lot of time pouring into this and wrote a really nice paper that was published earlier this year. But one thing that I found to be informative was what I call these spaghetti spiderweb plots, where he's looking at the four pollutants. So on the top is PM 2.5, on the right is fossil fuel CO2, on the bottom is ozone, and on the left is nitrogen dioxide. And we're looking at trends from 2005 to 2019, so the percentage change during that period for each of these 4 pollutants. The gray lines are for each city, and then the blue lines are the population weighted average across those cities. So for example, for the global spaghetti spiderweb plot on the left, we see no change in PM 2.5 on average, and very little change in nitrogen dioxide. A statistically significant increase in ozone, 6% increase shown in the significance is shown in the red dot, and then a 4% increase in fossil fuel CO2. Now that global no change in PM 2.5 masks a dichotomous pattern that we see where half the cities around the world pretty much are increasing and half are decreasing. So if you look at the high income region in the middle, we see decreases everywhere. So that's great. That's what we want to see. That in contrast, in South Asia, we see an increase in PM 2.5, an increase in ozone, and an increase in fossil fuel CO2. And we have this for every region. So we've tried to pull out, and I'm not going to go into detail here because it gets to be pretty detailed and granular. We've tried to pull out where are there relationships between each of these pollutants in each region, because this can be informative. If we're seeing, for example, that CO2 is increasing and nitrogen dioxide is decreasing, that may indicate that our catalytic converters and our technological approaches to removing air pollution from the effluent streams of these combustion processes are effective for air pollution, but they're not effective for CO2. If we see all of them increasing, all of these pollutants increasing, CO2 goes up, nitrogen dioxide goes up, we might be seeing a lot of economic expansion, a lot of industrial expansion without rigorous, stringent regulations on emissions. And when we see them all come down, we might be getting more energy efficient. Our processes are getting more efficient. So we can tell something about how different regions are performing on environmental quality by looking at how these different pollutants are trending over time. Now, this is the global picture using the Tropomi satellite, which, like I said, is a polar orbiting satellite. It orbits the planet at about 1:30 p.m. Local time every day. But we have a new asset in the United States that is just incredible. And this is the TEMPO satellite instrument. This was launched by NASA a couple of years ago, and data are flowing, people are analyzing it. And this is what the data look like. TEMPO is really amazing because it is a geostationary satellite. It hovers over the United States as the world spins, and it's taking one measurement per hour across the United States during the daytime, every day. So we're getting many more measurements from TEMPO. And in fact, when you compare the number of measurements we get from TEMPO to the number of measurements we get from Tropomi, and especially the air quality system, the AQS monitors, we have so much more information from TEMPO. So just imagine, where you see white areas here on this map, that's where clouds are. The satellite still can't see through clouds. That's very problematic for Tropomi because if there happened to be a cloud on any one given day at 1:30 p.m., there's no reading that day. But with TEMPO, because clouds move and it's taking measurements once per hour, we're starting to get measurements on many more days, and we can get a much better sense of how pollution levels are changing throughout the day. We get measures of pollution levels in places that are cloudy, and we can start to track new sources of emissions. We can track how emissions are changing after certain sources of emissions close. So it's really, really valuable, and our team is digging into this quite a lot now. Now, I want to return to these urban climate and environmental goals because we've talked about greenhouse gases, we've talked about air pollution. Let's talk about natural spaces because this is kind of newer in terms of urban targets. And urban green space has a lot of health benefits in terms of reducing environmental harm, like less heat, noise, and air pollution, restoring capacities like improved restoration and reduced stress, and building capacities like increased physical activity and social gathering. This is actually my commute to work. I'm a bike commuter, and this is the Capitol Crescent Trail in DC. I'm telling you guys, I arrive to work and I feel refreshed. I feel like I've done my exercise for the day. I've built that into my day. I started a period of time where I felt like I needed to use that time even more productively because I'm a crazy person. And I started listening to books on audiobooks during my bike commute and realized I was not feeling that degree of centeredness that I used to feel at work anymore. I didn't feel as calm. And I realized that even just diverting my brain from being in that green space to thinking about the audiobook removed that benefit that I was getting from bike commuting in this off-road trail. So just anecdotally, I personally get a lot of benefit from being in green space. And I can see how on a population scale that would translate into real public health benefits as well. C40, like I said, does now have some targets for urban nature. Not every city in C40 has signed on to this, but about 30 to 40 have. And they agreed to pursue one of two or both targets. The first one was the quality total cover target. And that target is to increase the overall amount of nature to reach 30 to 40% of the total built up city surface area. So that's about the amount of nature in urban areas. The second target was equitable spatial distribution. And this target was more about access. So ensure 70% of the city population has access to a green or blue space within 15 minutes. So the cities could choose which one of these targets they were going to pursue, or of course they could pursue both. But C40 had and the cities had no approach to tracking whether or not the cities were actually achieving these benefits. So that's what we set out to do. Greta Martin, who recently completed her PhD with me, this is the subject matter of her entire dissertation. So she started with developing a method to track urban green space, which was published in GeoHealth. Then she did a health impact assessment of progress towards urban nature targets in C40 cities, which was published in Lancet Planetary Health. And then she expanded this to over 1,000 cities worldwide, a health impact assessment of changes in urban green space, and that was published in Environmental Research Letters. So I just wanted to go through with you some of the results that she found, because I'm really excited about the potential avenues this could open up for tracking urban green space and the public health benefits that come along with that. So when she decided that this was going to be her dissertation topic, I was fully on board. And yet I knew very little about how to track urban green space. So this is all new to me. I have to admit that I do feel that in every PhD dissertation, there's what I call a wandering the wilderness phase, where you don't know exactly what you're doing and you're trying to make decisions to kind of get from point A to point B, but you don't really know what point B is yet. This was an extended wandering the wilderness phase. We had a lot to figure out, but it was very exciting as a result. So we started with, what are the data that were available to us to track urban green space? And so one data set that's available is the land cover classification data set. And both of these are rasterized. These are gridded data sets that you can use. That's what we needed to be able to get a sense for what urban areas are experiencing. So in the land cover classification, every pixel on the planet has a category assigned to it, whether or not is it water, is it desert, is it shrubland, is it deciduous forest, and it goes on. And so that's the land cover classification. The normalized difference vegetation index, or NDVI, is the other data set that we look to. And NDVI is a continuous measure from -1 to 1, and it measures the amount of green space, the amount of greenness. So you can see that areas of the world that are more green, based on their climate, do better on this NDVI scale, and areas that are more arid don't do as well on this NDVI scale. It's measuring greenness. You wouldn't expect a desert area to have a high NDVI. So these are the data sets that we look to. Now, the question was, which of these could we actually use to track whether or not cities were achieving their urban nature targets? And that secondarily, we wanted to be able to track not just how green space was changing, but how did the population health change as a result of that change in green space. NDVI is, land cover classification is very valuable because it's much more tangible. We can understand those classifications. We can understand whether a place is more desert or more shrubland or more forest. NDVI is more of an esoteric scientific metric that if you're working with city planners, may not be your best metric to use, but it is the metric that's used in most green space epidemiology. And that's what we needed to be able to translate the urban nature changes into public health impacts. So one of the largest multinational epidemiological meta-analyses out there on green space was published by David Rojas Reda and colleagues, and they found that an all-cause mortality hazard ratio of 0.96 for each 0.1 increase in MDVI within 500 meters of a person's home. Now try telling that to an urban planner, and they're like, I don't know how to use that. And neither did we. So we had to learn a lot about NDVI as a metric and how to translate that into a more tangible understanding of what green space is. But we needed that NDVI metric for each city to be able to translate the green space changes into health impacts. So we used both data sets. We used land cover classification and we used NDVI. We used them together to try to get a more comprehensive understanding here. So Greta first looked at the distribution of NDVI in cities globally, and I'm just picking out a few regions here. Washington, D.C. looks like it does much better than Phoenix. That's not a shock. That really goes to show that while there's a wide, there's a wide range of the pixel level values of NDVI within any given city. The more arid cities have a lower NDVI overall, and the more lush cities have a higher NDVI overall. And you could see similar things for Europe and East and Southeast Asia as well. The next thing we did was to track progress towards urban nature targets. So on the left-hand side here is the quality total cover target. That was the one that was about how much green space overall there was in the city. And then on the right-hand side is the equitable spatial distribution target. Each city here represents one of the C40 cities. And anything to the left of the vertical dashed lines show that the city does not meet the target, and anything to the right shows that the city meets the target. So we found that about half the cities met the quality total cover target already, and less than half met the equitable spatial distribution target, but some of them did. Now, if we wanted to turn this into health benefits of achieving higher, of a city who doesn't currently achieve the target to then start to achieve the target, we need to translate the targets into an NDVI. Because again, the epidemiological relationship between green space and mortality rests on this NDVI metric. So we actually had to create a city-specific regression for every single city, and we regressed proportion green area and NDVI, and we found this relationship, which we could then turn into a predicted NDVI at 30 to 40% green area. And that's what enabled us to estimate the health benefits of achieving these targets. But another challenging aspect that we ran into here, I'm telling you, we really wandered the wilderness for a long time here trying to figure this out. Because once we got to this point of, okay, we can estimate the level of NDVI that a city needs to achieve this target, where does the green space get added to achieve that level of NDVI? I did not even consider that when she started this project. But once we started to ask, well, where would the green space get added? We realized there's a few different approaches that cities could take here. And we're just creating these idealized scenarios to try to wrap our heads around the possible benefits that could come from this. So we developed 3 illustrative scenarios. What if a city added green space uniformly across the area? Or what if they added green space in the most nature-deprived areas of the city? Or what if they added green space in the most populated areas of the city? What would be the health benefits of these different pathways? And that's what we're seeing here. And I've just pulled out the results for Europe on the left and North America on the right. So what we see here is the estimated avoided annual premature deaths per 1% increase in green area per 100,000 people. So if you were to increase green space by 1% in these cities, what would be the avoided annual premature deaths? And we looked at each of the 3 scenarios. So the blue dots are the uniform scenario. The gold dots are the nature-deprived scenario where green space was added to the most built-up areas. And then the red dots are the population-centered scenario. And no surprise here, we found the greatest health benefits in the population-centered scenario. When you add green space where people live, you get more health benefits. But what was interesting is that when you look at the gold dots and the blue dots, you don't see a clear pattern across these different regions of the world. And in fact, in the European cities on the left, we found more health benefits from the nature-deprived scenario. And in the US cities, we found more health benefits overall from the uniform scenario. And I got to tell you, I don't really know what this means yet. We're still trying to make sense of this. Maybe it has something to do with the way the cities are formulated, with European cities having sort of a more dense urban area and the sprawl of the US cities, but I don't have a clear answer on that one yet. I would love to hear your thoughts if you have one. Greta also looked at changes over time, and this was for the Lancet Countdown Commission report, which is looking at how climate indicators change over time. And we found kind of a mix here where some cities around the world, and this is looking at about 1,000 cities, some cities around the world have more green space than they used to, and others have less green space than they used to. And we can't really figure out a clear pattern here yet. part of that murkiness is because there's a lot of things going on at the same time here. This is not at all necessarily driven by whether or not the cities are actually implementing actions to expand green space. This could just be due to the weather that year, the climate, how that climate interannual variability changes over the years, leading to different levels of greenness. So that's another step that we plan to take next, is to try to tease out the difference between natural variation, natural interannual variation, and city level action. So I've talked enough about these methods. I want us to spend a few minutes talking about how we've tried to translate this into action by working with boundary organizations that kind of take the science and work with people around the world to use that science to make the world a better place. So one thing we've been able to do is to improve the global burden of disease estimation. I've been working on methods for global burden of disease estimation for air pollution really my whole career. And what's really exciting is that we've seen this progression where when I was, not to date myself too much, but when I was graduating college, we were stuck with a few surface air quality monitors just in urban areas around the world. In my master's project at UNC, we used global scale air quality modeling for the first time to get complete geospatial coverage of air pollution estimates around the world. And you can see the numbers here. We had about 5 times higher estimate of the burden of disease from fine particulate matter when you are able to cover the whole world versus just the cities where there happened to be air quality monitors back in 2004. Since 2012, we've had satellite data, which gives us that geospatial coverage as well as spatial granularity. You can start to pick out those urban areas. And just in the last year, we were able to work with the GBD team to add nitrogen dioxide for the first time to the GBD study. So this is the first time that the GBD has an estimate of pediatric asthma impacts, or really any asthma impacts resulting from air pollution exposure. Which is kind of interesting because when you try to talk to somebody who's not an expert in public health or in air pollution, and you ask them what health outcomes would be associated with air pollution, probably the first thing they're going to say is asthma. And yet the GBD had not had a quantitative estimation for air pollution impacts on asthma, which it presents a communication challenge when you're limited to just talking about the mortality impacts, which are very severe, of course, and very important. But sometimes it lands more when you're talking about a disease that is more tangible to people to understand. So we found that with adding nitrogen dioxide, this pollutant contributes about 5% of all years lived with disability from childhood asthma. But I think what's another layer to this that is important for including NO2 and pediatric asthma in the GBD is the different regionality here compared with the other air pollution impacts. So what I've done here is I've just pulled out the rankings of the top 10 risk factors for children and years lived with disability per 100,000 people. And I'm looking at 3 different geospatial conglomerations. So on the left-hand side here is low sociodemographic index. In the middle is the United States, and on the right is Washington, D.C. So for the low SDI countries, nitrogen dioxide is not one of the top 10 risk factors. We see a lot of other risk factors affecting children's health. In the United States, NO2 pollution is the 6th most important risk factor for children's years lived with disability among children. And then if you look at Washington, D.C., which is the only urban area that you can pull out of the GBD because we don't have a state. So if you look just at Washington, D.C., NO2 pollution is the 4th leading risk factor for years lived with disability for children. The Washington, D.C. picture is probably similar to what other cities would look like if we could pull other cities out of the GBD. But it's an important risk factor for children here in the United States that was previously missing from the GBD study. We now have a separate paper just to describe the NO2 methodology here, in case you're interested. That was just published. We also have created a website, urbanairquality.online. Oh, it's on the bottom here. And this is an interactive website where you can go and download all of our data for these 13,000 cities. You can look at trends over time. And I just pulled out Baltimore for fun because I know a lot of you work on air quality in Baltimore using different approaches like low-cost sensors or other types of sensors to fill in gaps between the regulatory monitors. This is what we see. It's probably different from what you see. These are different approaches, and we wouldn't necessarily expect them to match up, but hopefully we see at least a similar trend. But so on the left-hand side is PM 2.5, and the orange line is Baltimore. So we see that coming down quite a lot. For NO2, we see Baltimore much, much higher than the country mean and even the state mean. And for ozone, we see it's coming down, but still elevated over the national mean. So that's a similar picture that we see in Washington as well. We have worked with a number of other, like I said, boundary organizations to try to get these data on the 13,000 cities into other groups' reports and efforts to try to improve air quality and CO2 emissions in other places around the world. We gave the data to the Health Effects Institute, who developed the first State of Global Air report focused on cities. They also have an interactive website. We gave it to UN Habitat for inclusion in their Cities and Climate Action report. The green space has now been added to the Lancet Countdown report, which tracks indicators of climate and health. So this is now a green space indicator that can be used in that report. One of the most interesting projects we've done is working with C40 cities and their individual cities to explore the air quality co-benefits of their climate action plans. Previously, none of these climate action plans actually had an estimate of what they would do to air quality concentrations, even though, like I said at the beginning, these emission sources generate both CO2 and pollution. So if we're going to take aggressive action to reduce CO2 in these cities, we're likely going to get a dramatic air quality improvement as well. There was just no way to estimate that in these cities' climate action plans. So we worked with Buenos Aires, Johannesburg, a few other pilot cities. I'm just pulling out these two because the way they included this in their climate action plans was quite different. So for Buenos Aires, they looked at a base scenario in the blue line and then an ambitious scenario in the yellowish line. And they found that PM 2.5 dropped about 35% between those scenarios. And it actually, at the time, it dropped them below the World Health Organization guideline, which was then revised from 10 to 5. So they're still above the World Health Organization guideline, but they would do much better on PM 2.5 in their ambitious climate change scenario compared with the base scenario. Johannesburg took a different approach, and they were looking at like the dual bang for the buck with different implementation approaches. So the x-axis here is the percent of total PM 2.5 reduction, and the y-axis is percent of total CO2 emission reduction. And the initiative that would get the best dual bang for the buck is an on-road mode shift. So that's people shifting from riding in personal vehicles to some other mode of transportation, like public transportation or biking or walking. But you can see some of the measures here that they looked at were great for CO2 reduction, like grid electricity decarbonization, but they didn't do as well for PM 2.5. And the opposite as well, like industrial fuel switch was great for PM 2.5, but not CO2. And just in a couple minutes left, I want to go back to this framework of how we need to be addressing emission sources at the source and considering both air pollution and climate change together. This is a co-benefits approach the term co-benefits has been around for decades, but it hasn't really been that successful, I'd say, in motivating action, motivating more ambitious action on greenhouse gases. I would say, though, that it's a concept whose time has come. It's very important now, especially in the United States, with the absence of the federal government, or actually the deliberate counter action by the federal government in addressing greenhouse gases. We need to be telling the stories of the local improvements that would come from climate action to motivate action. So I'm really excited about a new initiative we're starting at GW. We just launched this a couple days ago that we call Flip the Script. It stands for the free, local, immediate, and persuasive co-benefits of climate action. Free, meaning the benefits outweigh the costs. Local, meaning that is the local population that experiences these co-benefits as opposed to the global scale climate benefits from the reduction in greenhouse gases. Immediate, these co-benefits like improvements in air quality and health and green space are relatively immediate temporally compared with the over centuries improvements that we would see in the climate. And they're persuasive. People want walkable cities. People want green space. People want improved air quality. They want to be able to breathe. So we feel that the free, local, immediate, and persuasive framework can be quite valuable in motivating action. Now, we looked at 22 case studies around the world of actions that have been taken and the co-benefits that would come from them. And we classified them according to their health impacts, social impacts, economic impacts, and environmental impacts. And you'll see the most of the 22 case studies had improvements in environmental health, shown in this the second line here. So a lot of the case studies come up multiple places. They're achieving multiple types of co-benefits, and almost all the case studies had co-benefits for environmental health. This is a missing persuasive element of our discourse, which is mostly focused on the cost and political challenges and the difficult realities of climate action. What about all the improvements this would make to people's health? This is the different kinds of case studies we looked at in every sector. It's not just limited to, say, transportation or energy. These types of flip actions exist in every sector. We just need to be able to pull them out, quantify the benefits, and tell their stories. So this is what we're going to be working on in the coming years with the FLIP initiative. And with that, I want to thank many funders of this work. Like I said, this is work that unfolded over a period of about a decade. And we've had many funders and collaborators along the way. It also would not be possible to do this work without the developers of open access datasets. I'm a true believer in open data. So if you're somebody that contributes to data that other people can use and access, it's a true gift, and I appreciate the work you're doing. And also just wanted to throw out an appreciation for the federal employees whose work is really critical to supporting environmental quality and public health. So thank you so much, and I hope we have a few minutes for questions. Thank you.